Hello colleagues, hello my viewers. I hope you are all doing well. Today we are going to look at the second phase of the nursing process. Nursing diagnosis as the second phase of the nursing process is a very necessary step, where after the nurse has done assessment, identified what the patient's problems are. Now the nurse has to coin that patient's problem into a nursing language. Like in my local dialect, if the patient cannot brush the teeth, we say that patient with me in tree. If patient cannot brush her teeth, it's English, it's plain English. But how do we call it as nurses? So nurses will say that self-care deficits into bracket brushing of teeth. This means patient cannot care for himself or herself, particularly brushing his teeth. So when we look at medical diagnosis, you see that it labels a whole condition, but nursing diagnosis, we are concerned with the signs and symptoms patient is presenting with. You shouldn't forget that the nursing diagnosis is patient-centered, and we look at the patient as a whole individual, and then we also consider holistic care, every need of the patient. So not only interested in the medical diagnosis of the patient, we want everything that is wrong with the patient, be it social, spiritual, physical, mental. We diagnose. That is how we nurses diagnose. So we say that nursing diagnosis is based on signs and symptoms that the patient is presenting with. So any problem that patient comes with, we identify the problems during the assessment phase. Then at the second phase, we have to label the problem the way the nurse will understand it. So in nursing diagnosis, the most simplest one is the diagnostic label plus the related to factor. The diagnostic label is what is wrong with the patient. How do we say it in nursing? Patient is vomiting. We say that risk for fluid volume deficit into bracket vomiting. The into bracket becomes necessary because that diagnostic label can fit a lot of problems. So we want to tell specifically that it is vomiting that we are talking about. So you put into brackets vomiting. Related to, that is what is causing the problem. So in your assessment phase, when you are probing, you should find out the possible causes of the patient's problem. You can find these causes from patient through interviews. You can find out, why are you vomiting? What do you think are some of the things that has led to the vomiting? Sometimes the patient's medical diagnosis will give you a clue of what is causing the vomiting. Because you're a nurse, you know the pathophysiology of the medical diagnosis, so you can know what is going on in patient's body to go and cause the vomiting. So you can have risk for fluid volume deficit into bracket vomiting related to gastric irritation, related to increase or decrease acidity of the gastric content. So you can have a lot of related to factors, related to microbial invasion, related to disruptions of brain activity, a lot of related to factors. And that is why we say nursing process is a critical thinking approach. In writing nursing process for a patient, you shouldn't forget that we use NANDA. That's the standard that we use, especially in Ghana. Here we follow the NANDA standard, and that is the NANDA standard. That is North American Nursing Diagnosis Association. They review the nursing diagnosis quite often. So you see that some diagnoses will become archaic, new ones will come. At first, pain was not a nursing diagnosis, but now pain is a nursing diagnosis. The only thing you have to add to pain is you specify where the pain is. So if you write pain into brackets right arm, related to trauma. You shouldn't also forget that nursing diagnosis, we have actual, we have potential, we have risk. And so those ones, if you understand what they are, it guides you to give the right diagnosis and guides you in planning for the care of the patient. Thank you.